In the last year, the pandemic has put the healthcare system across the country to the test. In rural areas, that additional impact is yet another blow to an already fragile balancing act in getting proper medical attention. In this three-part series, I took an in-depth look at the health system in the Upper Peninsula, from the obstacles of providing proper care to patients, a local program that is training the next generation of rural doctors, and a closer look at some of the talented doctors who are dedicated to making sure the unique needs of rural communities are met. Tonight, we conclude that series by discussing a major obstacle medical students face, as well as shining a light on the bright students who are practicing rural healthcare in our community.
These are young, highly motivated, skilled people who have dreams.
Earlier this year, 6 medical students from the Michigan State University College of Human Medicine Upper Peninsula campus received the Mazzuchi Scholarship.
Dr. Daniel Mazzuchi is the primary reason, the primary physician of why this program exists. He had the determination and put in all the energy and hard work to get training happening in the Upper Peninsula.
The retired doctor humbly reminds every scholarship recipient where the support comes from.
The scholarship that they got, while it's named for me, is not from me. It's not my money. It's from the community.
The money for the scholarship comes from local business owners providing donations, as well as residents putting a portion of their will or estate into the funding. A large number of physicians who are being paid to teach even put their own paychecks into the scholarship. The fabric of the Upper Peninsula is built on helping one another, and everyone we spoke to agreed that the expense of medical school was an issue.
It's not easy. I mean, the expenses of medical school are horrendous.
I don't think a ton of people realize just how much debt a lot of physicians have to go into.
Medical school is very, very expensive.
The financial burden for us students to be able to focus on our education.
The financial worries. Financials.
The finances as I make decisions of what my future is going to look like.
The students who received this scholarship understand the need for healthcare in the Upper Peninsula, such as NATALIE Thompson from Gladstone.
My mom personally, she had breast cancer and she wasn't able to get some of the services like radiation treatment. She wasn't even able to get it here or in Escanaba, close to where we live. When I was applying to medical school, I knew I wanted to do rural medicine.
Rural physicians face unique challenges and are characterized by their hard work and passion for the career.
Our goal is to train people who want to care for populations in rural communities. That is the number one goal, and we know how difficult it is. You have to have grit and determination to be a rural physician.
These skills are critical for an area with specialized needs such as the Upper Peninsula.
It is important for homegrown physicians to return back, and even for those who aren't from here to return, because just training in the UP is very important towards creating physicians who are prepared to care for the population of the UP, just because the needs that the people face here are different than those in other rural areas.
Beyond understanding the science behind medicine, being a rural doctor requires a homely approach that focuses on the patient's needs.
The best physicians now are those who are the most compassionate and have the best interpersonal skills that can motivate their patients and kind of do some of those intangible things.
As difficult as medical school can be, Josh Cole, who is a first-generation college graduate, has some advice.
Even though it seems insurmountable, you can get there. Rely on your family, your friends, your counselors, everybody around you. The community that you live in is really how you propel yourself forward. And that's something in the UP that is probably the strongest asset of everybody around is the community.
A sentiment shared by fellow third-year medical student Jenny Wickens.
Being able to rely on other people, being able to ask for help. So a little bit of humility goes a long way in the medical field because none of us know everything and none of us can do everything. And then as far as sustaining, I think you do need empathy for others, and certainly everyone at this campus that I've ever met, all the faculty and all the students here definitely have a lot of empathy and a lot of care for their community. And so they're not just doing it for a job. They're physicians here because they love these people and they love this place.
That love allows rural physicians to take an active role in the local community.
You get to be a part of the community in which you're working. Really becoming a staple of that community really helps you feel like you are serving that community and being more engaged with them.
Thanks to the Michigan State University College of Human Medicine Upper Peninsula campus that has served the community since 1974, the programs at the campus have developed the necessary skills of 310 medical students and 210 family physicians. This year shines a light on our healthcare workers as heroes, and these scholarship recipients continue that legacy, providing a much-needed resource to our community. I'd like to thank the amazing students and staff who dedicated their precious time and provided their enthusiastic energy for these interviews. Your effort was greatly appreciated. Congratulations on receiving a well-deserved scholarship, and my sincere gratitude for your help in allowing me to get a more in-depth understanding of meeting our rural healthcare challenges, the program that is rising to meet those needs, and the amazing students who are dedicated to our community's health.